how to code for removal of an artificial urinary sphincter and repair of the urethra under the same anesthetic? Well, that is the question we are going to try to answer today. Hello, my name is John Lin. I'm a urologist here in Gilbert, Arizona, also the humble host of the Thriving Urology Practice Facebook group, where our purpose is to help all urologic practices succeed. Now, in our Facebook group, members are encouraged to ask questions regarding coding, billing, and simply how to run their practices better. Today's question came from Stacy, who asked, when you remove an eroded artificial urinary sphincter and perform a urethroplasty, do you bill for that separately, or do you just bill for the removal of the sphincter? Well, that is a great question because you don't know, right? Do you just bill for the removal and call it good, or do you bill for the removal and also the extra work that is involved in fixing the urethra? That's an excellent question. Of course, anytime we look to try to answer a billing or coding question, the first place we go to is the operative report. Let me give you a little bit of background without disclosing too much information. Obviously, when the information, the op report was sent over, no protected health information was disclosed, but it gave a little bit of background. So here it is. This is apparently an older gentleman who had prostate cancer, had his prostate removed, and became incontinent. He had a urinary sphincter placed. It did not work, and then he had it replaced, and this replacement apparently eroded through his urethra. So we got two things going on here. One, the sphincter, obviously when it erodes the urethra, you have to remove the components, and I think during the discussion of with the patient of the situation, the surgeon decided, okay, we're just going to remove the components and not try to do anything else. In addition, the cuff of the sphincter eroded through the urethra, and that needs to be fixed. So the operative report goes something like this. Under IV antibiotics and general anesthetic, the patient was placed on a table and then placed in lithotomy. An incision was made through the perineum, through the old scar. Dissection was carried through. The cuff was removed. The tubing was removed. And the erosion in the urethra was easily seen. And that was reapproximated using interrupted sutures to create the reapproximation and closure. And this was done without any difficulty. And fortunately, everything went very well. And a Penrose drain was placed, and through separate incisions, the rest of the components were removed. So that is the gist of the op report. Basically, two things were done. Number one, removal of the sphincter, and number two, the eroded urethra was repaired. Okay, fairly straightforward, you think, right? Figure out the codes for each and then bill for both. Not so fast. First of all, removal of the sphincter is pretty straightforward. There is a code for that. And to help me code for these procedures, I'm using the AUAcodingtoday.com. It's a website. It's a subscription service that is in collaboration between the AUA and the PRS network. They came up with this incredible resource called the AUA Coding Today. You sign up for it, and basically you type in AUS removal, and it comes up with a code, and that code is 53446, removal of inflatable urethral bladder neck sphincter, including the pump reservoir and the cuff. That in itself is very, very straightforward, but you also have to account for the urethroplasty. Now, when you're talking about urethroplasty, first of all, there's male and female urethroplasty, straight urethroplasty, and then urethroplasty because of hypospadias. So those are all separate things. Also, in the male, you have to figure out, is it an anterior urethroplasty, posterior urethroplasty? So you also have to figure that out. Although it was not specified in the op report, the urethroplasty can be assumed to be done in the bulbar urethra because that's where these cuffs are usually placed. So bulbar urethra is part of the anterior urethra, And you have to also determine, was this repair done in one step or is it a two-stage repair? Because it also matters if you thumb through the CPT code, it makes a difference. In this case, this is an anterior male urethral repair, and it is done in one stage according to the operative report. So it is not you do part of it and then you come back another day to finish the job. So in this case, this will be a one-stage urethroplasty, and that code is 53410 according to the AUA coding today. Urethroplasty, one-stage reconstruction of the male anterior urethra. So you may think, yay, that's it. 2 codes, put them in, put it in the claim, and you are done. Well, not quite, because in 53410, this code is assuming that the exposure has not already been done, such as during removal of the artificial urinary sphincter. This assumes that you are making, you put in the work, you put in the effort to perform this type of repair with a fresh incision. Now, when you are performing removal of the artificial sphincter, the incision's already made, the exposure is already made. All you did, or the surgeon did, was simply repair the eroded urethra, the little area that is eroded through. And in this case, it was done through an bunch of interrupted sutures. So should you be billing for the full charge of 53410? I personally don't think so. In my opinion, I think the appropriate coding should go something like this. 53446 for removal of the sphincter, and 53410 with a modifier 52 for reduced services. I think that makes the most sense when it comes to coding for this particular situation. Now, you can, if you're not sure if you can put both of these codes and bill for it, in the AUA coding today is something called the bundling matrix. And I will show you that. If you enter the codes 53446 and 53410 into the left-hand side box on the right hand and hit enter, on the right-hand side, you will see that you can bill both codes and without any modifiers. So that is another strength of the AUA coding today. It allows you to put in all the codes that you want, and it will tell you whether or not it's bundled, not bundled, or whether or not a specific modifier may be used when clinically indicated, when medically necessary, so that you can pull that out of the bundling. All right, that is about it, guys. If you guys have any questions, concerns on this particular issue, please leave them in the comments. I have placed a link to the AUA coding today in the video description. Please feel free to visit them. This is not a sponsored video. I just use their website, and I'm using that as a way to help educate everyone on this particular scenario. Hopefully this helps some of you. And if you know of anyone who is interested in joining the Thriving Urology Practice Facebook group, please invite them. I will also put that in the video description. Otherwise, have a great night. Take care.